I'm the Director of Cardiac Electrophysiology at St. John's Health Center and Pacific Heart Institute in Los Angeles, California. I was born in the United States, trained there, did most of my training in Los Angeles, then moved to Boston and trained at the Massachusetts General Hospital at Harvard Medical School in electrophysiology, and moved back to Santa Monica, California 10 years ago, where I became director of the lab. So thank you very much for the invitation to the International Center of Arrhythmias. I first met your team and Dr. Sands in Los Angeles at our hospital. The team came to observe left atrial appendage occlusion procedures, which were under investigational study in the United States. They kindly invited me to come here to give a presentation this morning about the new procedure, new techniques which are being done at this hospital. The results have been fantastic here. We had an excellent meeting this morning. We discussed the procedure for patients with atrial fibrillation so that they don't have to take blood thinners anymore. We did some procedures today. Got an opportunity to watch your team work here at the hospital. And we will complete the meeting later this weekend with a follow-up lecture. Again, I'm very privileged to be here today and spend time with your team. So this afternoon, we did procedures involving atrial fibrillation patients. It was a young woman who had very symptomatic arrhythmia. She felt her heart beating out of rhythm, made her feel very tired, and they performed a catheter ablation procedure, which was very complex in this patient who has had this arrhythmia for some time. And one of the markers of a very successful procedure is the ability to make her rhythm go back to normal during the procedure, which they were able to do today very early in the procedure. The patient today was a young woman who had very symptomatic irregular heartbeat called atrial fibrillation. The procedure Dr. Sands performed was a catheter ablation procedure where they put wires from the vein in the leg into the heart, and he basically was looking for the region that was causing the electrical short circuit. And this patient was very symptomatic for many years, and within the first 2 hours of the procedure, her rhythm was back to normal. So I would say it was a very successful procedure, and the patient should do very well. So the primary purpose of this visit was to discuss a new technology and a new approach, which may have a bigger impact in many of our patients' lives than anything we've seen before. And that's specifically in patients who have an irregular heartbeat or arrhythmia called atrial fibrillation. In atrial fibrillation, what happens is that there is a pouch inside the heart, like an appendix, which doesn't squeeze. And so this is where the patients get blood clots. And many of these patients are at risk of having a stroke because the blood clot can get dislodged from the heart and go to the brain and cause a stroke. And for now, the only therapy we've had for these patients is putting them on a blood thinner. The problem with blood thinners, as one gets older, is that you have an increased risk of bleeding. So as older patients have a risk of falling, they're taking multiple medications, they're all at increased risk of bleeding. So for decades, we've been looking at a new way or a different way of reducing a patient's risk for stroke without putting them on a blood thinners. And so this is why we're talking about left atrial appendage exclusion or occlusion with a device called a Watchman device. What we're talking about is putting something inside the pouch to seal it off. So these patients don't need to take blood thinners anymore. And what you find is that patients who have been taking blood thinners for years, who deal with problems like bleeding, bruising in the skin, nosebleeds, stomach bleeding, all these other issues, they're so grateful when they're able to get off the blood thinners, and their quality of life is so improved. And within the last 5 years, we have implanted this device in thousands of patients. And in an under clinical trial, what we see is patients who have this device actually have fewer strokes, live longer, and less bleeding than those patients who take the blood thinners. So based on that data, we're looking at promoting this technology to these patients who have arrhythmia. And the reason why it's especially important for Colombia and Latin America is that patients in this part of the world have a difficult time being on blood thinners. It is hard for them to be just in the right range so their blood is not too thin or they will bleed, or the blood is too thick or they have a blood clots. And it's primarily in these areas where you can really help a patient with one procedure. In 45 minutes, you can take him off of blood thinners potentially for the rest of their life. So we're very excited to promote this technology and discuss it with the team here. And like I said, Dr. Sands has done an amazing job. They've already done almost 10 cases, and the patients are doing very well. So we're excited moving forward. So the purpose of this procedure is to give a patient a normal life. patients don't feel like they have a normal life when they're on blood thinners because they're always scared, always worried if they touch something, if they get cut, the dog bites them, are they going to bleed? Or bleeding inside their head, it's a major problem. And so what this procedure allows them to do is have the same benefit of taking a blood thinner without the risk of bleeding, so essentially brings them back to a normal life. Patients undergo this procedure typically in less than 1 hour, and when they go home the next day, they don't feel any different. It doesn't make you feel better, it doesn't make you feel worse. You just don't have to take the medicine which is causing a lot of problems. And so the procedure does not treat the irregular heartbeat. The irregular heartbeat is something that we get as we get older, and we can't always fix it. But the one major risk from having atrial fibrillation is a stroke. And so what this procedure does is it reduces that risk in the patients who have the irregular heartbeat so that they can live a normal life and be less worried about having a blood clot in their heart or a stroke. I was very impressed by the Cardio-Infantile Foundation. This was my first experience in Colombia, my first trip to Bogota, and you walk into this hospital and you feel like you're in complete modern technology. You would not be able to differentiate this hospital from many of the other top hospitals in the world. All the technology is here, all the infrastructure is here, and actually spending about 7 or 8 hours in the electrophysiology and catheterization laboratories really impressed me about your technology. You have every equipment that we do in the States here. There's nothing that is lacking. The one thing that is very clear is you have the personnel, you have the physicians, talented physicians like Dr. Santz and the rest of the team here, and you have the technology. The next step is really to increase awareness and education of the public in the community and the other physicians in the country. So as the complexity of the procedures increase, as the results are being published, showing that in Bogota you can have as good as results, if not better results than anywhere else in the world, it will increase the awareness of the public of what a fantastic center you have here.